And we could agree, and we could also agree your agenda is important. So that's the fat issue. I talked about the mineral issue, and I also want to talk about the fact that both diets, meat eating or that, and I'm going to talk general public, because if you talk about only your exception, I'm only the purest meat, the purest this, or the purest, we're not seeing the picture. The picture for the world, and I'm going to talk about the United States, is 90% of pregnant mothers are deficient in long-chain omega-3s, DHA and EPA. Now, 90%, that means meat eaters, right? Because what? Vegans are, 0.5%, and vegetarians are 3%. Okay, 90%. Guess what? 50 to 85% of the general public is low in vitamin D and vitamin A. Now that doesn't just apply to plant sources, it applies to everyone. So when I see it, because 50 to 60% of the population I see actually are meat eaters. So I'm seeing both. And quite frankly, I can't tell the difference. Okay? So we have A, D, K, omega-3s, everybody's low in omega-3s. And I think it's 70% of the American public is low in the long-chain omega-3s, besides 90% of the pregnant mothers. And in Canada, pretty much the same results. Now we're going to go a little further, and one of the other kind of deficiencies is the B vitamins. And I want to make another statement here because I think it's important to get. I haven't found a person who's B12 functioning, a meat eater or plant source. I haven't found one. And why is that? Because people are arguing academics. I'm testing the people, see? And we got two things going on. So you can say, I'm getting adequate B12, but are you really? We live in a world that is totally chaotic. Electromagnetic problems, stress is like doubling, tripling. Actually, it doubles every 10 years. And you're just burning the stuff up. So I see almost everybody B vitamin deficiency and B12 deficiency. Everybody needs a B12 total supplement. Now, that's an important piece because your B vitamins affect your mental state as well. We're going to get to that in just a second. So those are what I'm going to call the areas of deficiencies that are blatant that everyone has. I haven't seen, as one of the people pointed out, zinc deficiency. I haven't seen it that much really in plant source people. And I don't think iron has really come in. And it may be that they're just low, but what I'm going to call not limiting factors. But we do know some research that's fascinating. The amount of anemia decreased in World War I and in World War II, and that was related to less animal protein. So I think there's a discussion, which I don't want to go into, it's too small, but I think if you're eating your greens, you get what's needed for iron absorption is vitamin C, and you really get it in the plant source foods. Nevertheless, everyone's deficient in vitamin C. And so how can all this be? We're eating right, what's the problem? There's a big problem. The problem is the way the planet is, there's a serious decrease in animal and plant life energies. And so their nutrient densities for animals and plants has decreased. And so I want to bring in the other principle, which again, most of the doctors in this discussion talk about, because we're not talking theory, we're talking clinical experience, and that does affect how you see things. If everybody's deficient, you need to use supplements. And I want to be very clear that food concentrate supplements are a way to go, but it really speaks to another thing that the natural hygienists and kind of vegan absolutists don't want to recognize is you actually do need supplements because our plant life, our soils are weak, animal life, it's just too weak. And we have too many things disrupting it because electromagnetics disrupt it. When you're going to blend your stuff, you're going to disrupt your nutrients. It's just the way it is. So I think that's another consideration in this whole picture is, yes, we do need supplements. And most of the doctors in the health debates agree. And certainly McCullough and I agree. But Dr. Williams, certainly I know because I've been getting his newsletter for years, and he certainly talks about supplements. So I want to add that that's a very important part. Again, we don't care about your theory, we care about clinical reality. And that's how we're going. And that's why I go with what the doctors are saying. These holistic, I call them not even holistic, the doctors are looking at these nutritionally oriented doctors, is we mostly all agree you need supplements. We don't go with the hygiene thing or with natural hygiene, or we also don't go with the allopathic doctors, oh, your food can give you all you need, as if they know what they're talking about. So we are checking people. Now I want to say one other thing, and I think it's great that Kevin's finally, is out there promoting checking and getting blood tests, hair tests, whatever. I want to talk about some problems with that way of thinking, the limitations. I think it's a good thing, but I think it's not really adequate. Why? Because a book called Biochemical Individuality came out in 1950 by Roger Williams at the University of Texas. What did he say? There's a great variation. Some person may need 5 times more B vitamins than another. 5 times more of this than another, or 10 times more. So they have on the blood test, quote, normal, but nobody's normal. We're all unique. Once you get that, so don't take it personally, you're not normal, we are unique, then simply trying to sit an average into that doesn't help you. And I'll give you an example of this, and this is just straight medical school stuff. At Columbia, they took people who all had normal B12, serum B12. They gave them a shot of B12, and 30% of the people felt dramatically better. What does that tell you? It tells you that, quote, normal doesn't speak to a whole lot of people. If you miss 30%, that's not very good. So we do other levels of testing that are more about to the person. And blood tests are not to the person. And that's why they give you a rough idea, but they're very, very limited. The other thing I found, particularly hair tests, were particularly inaccurate. I remember when I was using hair tests, I got suspicious, so I sent the same hair test to 3 different companies. I got 3 widely variant answers. So there are some technical things that concern me. But nevertheless, it's good to check. But I'm saying meat eaters as well as vegans, plant source only people, all are deficient. And we shouldn't keep thinking, because it's kind of a brain paralysis, it's only, plant source only people are deficient. It just simply is not true.